Ketamine is one of the most powerful medications that we have discovered to treat depression, anxiety, PTSD, and even chronic pain. So when so many patients called me last week asking me about the latest Real Housewives episode on ketamine, I had to go back and watch it. Here was my live reaction. And remember that I've actually shown a video of a real live patient receiving IV ketamine. You can check that video out in the description below.
Adrianna is about to get shot with ketamine. I'm seeing her being so wired. I just don't think it's good before going to this therapy.
Yes, she is totally right. You don't want to show up wired to a ketamine session because unlike any other medication that we use in the West, the mindset you bring into a ketamine session has a huge impact to where it takes you. Similar to before you go to sleep, the mindset you have before you go to sleep will play a part in what you dream and how rested you'll wake up. And she's totally correct on that one.
Okay, well, after this conversation, God knows I need some ketamine.
Yeah, so that is not the mindset you want to be coming into a healing ketamine session.
Yeah,
That's nice.
Michelle Weiner. Nice to meet
The
you.
doctors seem nice there.
This is what I tell all of my patients. You are in our home, and we're not going to let anything bad happen to you.
Oh, that makes me feel nice. You're in my home. So to be clear, no patients ever get ketamine in my home. But it is very important, they're correct, that you want the center that you're receiving the ketamine in. That environment is crucial to how healing that experience will be. So I think they did a very good job in emphasizing that to an otherwise anxious and potentially nervous patient.
In the first 5 minutes, you're probably not going to see much. After the next 5 minutes, you're going to start going to see colors, and you're probably going to go into another realm.
All right, how many minutes does it take for ketamine to kick in? So Adrianna is going to get intramuscular ketamine. You're going to see a big needle in a minute, I think. And that's different than IV ketamine. It's different than intranasal sprays of ketamine. Every type of ketamine gets absorbed differently into your bloodstream, has to go into your bloodstream to reach your brain where it works. Intramuscular ketamine takes a couple of minutes, that's correct. IV ketamine can take a number of seconds, literally. An intranasal spray might take even longer, and an oral or a sublingual ketamine will take even longer than that.
You're still going to be here, but you're also going to be there, okay?
I'm ready to go somewhere.
I'm ready to go somewhere too. That's quite accurate. There's what's called an out-of-body experience with ketamine. Now, everyone's going to have a different ketamine experience, to be clear. It's like when you go to sleep at night. I don't know what you're going to dream about. You don't know what you're going to dream about. And every night is going to be a little bit different. But that feeling in a different place absolutely can happen, and it's important that the patient, like Adrianna, was reminded and reassured prior to experiencing that unusual, altered state of consciousness.
I think the last couple of years I went through a lot. Losing my father, lost my brother, then I got divorced, and I became an empty nester.
That's really sad. I appreciated her vulnerability in sharing that, and being open about what we are hoping to heal from with ketamine is a very important part of how healing the ketamine will be for us. There are so many patients that come to me with PTSD, chronic pain, anxiety, or even addiction, and ketamine can be helpful by addressing the root causes. I think we're going to see in Adrianna how addressing those root causes can be emotional sometimes. But we want to change the relationship we have with those emotions so that they ultimately empower us to be in control.
That made me go to a space that is not the happiest I've been.
Exhale.
Yeah, that's a long needle. All right. I don't know. This is the first time I'm seeing something that's a little bit unusual, perhaps. That's a long, long needle. For something as easily absorbed in the bloodstream as ketamine, I don't know why we need such a long needle. I typically use much shorter needles in the hundreds that I have injected in the past. 6 minutes. Magic number.
Into the music. Like I'm floating and I'm the music and I'm the notes. I'm just floating, floating, floating.
So I do allow others to accompany my patients when they come in for their ketamine infusions. Once again, this is an intramuscular shot. I typically use infusions. It's what you saw in the other video I had with my patient. But it's important that the person who's with the patient might not necessarily be rolling their eyes or raising their eyebrows, but is there to be supportive. I'm sure you'll see this other individual be supportive as well for Adrianna, but certainly we can do things or act out in ways that we wouldn't act out or say if we didn't have ketamine on board. And it's important for whoever is there accompanying the patient to be aware and familiar with what they might expect so that they can be supportive for them.
I'm cuckoo in my own way.
Yep,
Take
this
me
can
as I
absolutely
am.
happen. This can absolutely happen.
Oi, meu irmão. Marcelo. I love you.
Yeah.
Should have gone first.
Even though it looks really uncomfortable, and sometimes it is, what we want to do is that by having the ketamine on board, inducing what's called neuroplasticity, we are changing our relationship fundamentally with those memories. So even though they might be sad or charged when they're coming up, with the ketamine, we're able to consolidate those memories, or what we call induce fear extinction, meaning that they don't have that same hold on us like they may have had at one point in the past. That's how we can help overcome conditions like PTSD potentially. It's how we can help become unstuck from depression or anxiety. And if you're learning something new, please hit that like button and ask me your questions below. Maybe you think ketamine is right for you or for a loved one. Ketamine might be a powerful, powerful treatment for you that can bring about rapid results. But you need to speak with your doctor, of course. But let's get back to the video.
Oh, my father!
I wish I could say that was over dramatized, but I have seen this happen many, many times. It's not bad. It can be a little bit jarring if you don't know what to expect, but this is why we place so much heavy emphasis on the preparation before receiving ketamine. So one thing I didn't see in this video, and I'm sure they did it at some point before, but having the right mindset before you enter can help minimize the risk of having uncomfortable or nightmarish-like emotional experiences like this one. I'm really happy that she's having someone there to help support her during this challenging time. We'll often have an expert guide like myself or another physician there to help reorient a patient who's having an emotional experience or an emotional trip to make sure that it does not enforce the PTSD or the past trauma, but rather help heal from it and overcome it.
Oh, my God.
Sometimes when this happens, we'll actually lower the dose of IV ketamine. One of the differences between an intramuscular shot versus an IV is that once the shot is given, you can't take it out. Or once you swallow a pill or take a spray, you can't take that dosage out. With the IV, however, you stop the IV. And typically within minutes, the effect is gone because you're no longer adding more ketamine to the system.
I never got to say goodbye. He died before I could say goodbye to him.
I have held many, many hands for many, many hours. That is very accurate.
Do you want to share with me what you're seeing?
First, I felt very like light. I was floating, happy, and I saw my brother, and then I saw my father.
It's very effective to have that debrief with your doctor after the infusion. That's really powerful, and I'm very happy that they showed that to help make the most of that experience so that the patient can make the most of that experience to last even after the acute effects of the ketamine have passed.
Was he peaceful?
Yeah,
Did you feel scared at all?
no. It's good to be in a place where there's all peace and love.
Right.
Yeah, I've definitely had patients tell me that they've seen family members, maybe deceased family members, not an uncommon experience at all.
So instead of feeling loss or being identified by all of your losses, now you can really tap into that peaceful feeling and know that you can access love as well.
And that's also dead on how important it is to feel that safety and comfort in the center that you're in with the doctors that are working there. I'm very happy that they emphasize this.
How does your body feel?
Tingly. Hi. Back to planet Earth.
Back to planet Earth. So this was a fairly realistic, in many ways not all, depiction of ketamine therapy. Is it the ideal ketamine delivery? It's hard for me to say. It's going to be different for every individual because the fit is so important, just like for a therapist or for any other doctor. And I encourage you, if you are struggling to heal from depression, anxiety, PTSD, or chronic pain, to do your research and interview the ketamine clinics around your area if it's something that you're interested in. I have a couple of videos on what to look out for, what scams to watch out for in particular, so that you find the right fit to maximize your chance of healing from a responsible and ethical clinic. The wrapper around the ketamine therapy, especially the preparation and the integration that comes when we reopen the critical window that's necessary for lifelong healing, is so important to you getting the healing that you deserve from ketamine. Please leave your questions in the comments below. And if there's another video that you want me to react to, let me know below as well.